When she was 2.5 years old, she get a vaccine, and after the vaccine, 1 month after the vaccine, she diagnosed with the autism. Since this time, everything is changed in our life. We couldn't go outside like we want. We couldn't sit in a restaurant. We couldn't travel like we want because everything is getting harder and harder with her. We didn't have control over her. Child is more important than the money. This is the last chance we have, I think, because it's the last technology you have for the autism. If maybe something comes later, but maybe not. So I will try it now.
Good afternoon, sir.
Good
Can
afternoon.
you please tell us what's your name, where you come from, and what diagnosis bring you to Swiss Medica?
My name is Abbas, and I'm originally from Iraq, and I living in Sweden, in Stockholm. And my daughter had diagnosed with autism, so that's why I coming to Swiss Medical.
Okay. When were she was diagnosed, and how has it affected to your life?
When she was 2.5 years old, she get a vaccine, and after the vaccine, 1 month after the vaccine, she had autism. She diagnosed with the autism, and since this time, we had everything is changed in our life. We couldn't go outside like we want. We couldn't sit in a restaurant. We couldn't travel like we want because everything is getting harder and harder with her.
And what symptoms have you dealing with?
She's shaking the hand, shaking the head, make a voice like a very long voice and deep. She make, and she's every time she's running, jumping,
Hyperactivity.
yes, hyperactivity, and that's kind of things which we are not, we couldn't control. We didn't have control over her.
Tell us, if you can, what was the most difficult moment in your life related to the diagnosis before you get stem cell therapy?
We thinking about this thing, but we have traveled too many places to and try too many things to see if she get better, but the effect was very small. So that's why we come here this time to try this technology or this kind of
new technology.
yeah.
And what treatments have you tried before?
It's we have been too many places in like Iran, like Dubai, like another place to ensure our daughter and get some medicine, but it was some of the medicine had a little effects, very little, but not enough.
Yeah. Understood. And what was the deciding factor to why you choose stem cell therapy?
Because it have been before 2-3 years ago. I begin to hear about it, and after this I begin to study about it and look at the internet how many child get better, how many child affected, like how many child have something from this, and it's begin to be better and better in the last year. So that this make me to take a chance and come here, and I try with my daughter.
Nice. And how did you know about Swiss Medica?
My sister, yes, my sister, she's working at the pharmacy in Stockholm.
Okay.
So one of her clients had her child in this hospital, and he was getting very different, very better after this. So she tips my sister to try this hospital. We try it. It was good. We had good what is called experience. Yes, good experience with this hospital, and our child get better after we was there. And you can take a chance to. So when my sister come to me and tell me she heard from this and give the name to me, so I begin to.
Yeah, so actually you speak with a doctor.
Yeah.
Did you speak with your primary doctor back in Scotland or Stockholm or?
No, but about this we cannot talk too much about this in Stockholm, because they don't believe this kind of technology or something, because everything is cost in Sweden. They don't need it. So.
Exactly. What are your expectations like for long-term period after the stem cell therapy? What you expect?
I don't know. When we talk to the doctor here, he tell me it's between, maybe you can see the change 1 week, maybe 10 week, maybe 12 week, maybe 2 months, up to 6 months. It can be, depends on which child is this.
Depends on the kid,
Yeah, the kids, and how much is the niveau in his or her autism. So it depends on.
Have you noticed some improvements yet, or there is no improvement yet?
Now is we begin this week. We come this week. So it's she had 2 procedure now, and 1 procedure tomorrow. She will have it, and until now it's normal.
It's like has been.
The child is normal. Nothing affecting her badly, but she's positive.
Yeah, and you said that you have been to the many clinics before. Can I ask you, why did you choose Swiss Medica over other clinics?
Because when I look, it's 2 places in the world now is have this technology, and the one is when it is in Europe is Swiss Medical. It's closest to me. So the other one was long and far from our place. So Swiss Medical was closest to us.
Closest one. Okay. And for the last, we always like to ask, like, do you have some advice for the parents that has the kids with similar condition?
Yes, I will say, as a parents, you try everything, and I think is the last thing you can try it too, because if you think maybe 10 years after you don't take this chance, so maybe you will sitting and will tell you why I didn't take this chance. Maybe it was some hope there. So everything is not willing to happen, but we will to do it for our child. So take the chance. I think you have to take the chance when it's because it's a new life. A child is a new life. So how much you can give to this child to come normally and live normally, it will be effective, positive in his life. So I will say, take the chance. Nothing worth in this world.
Yeah, you got nothing to lose.
Yes, you got nothing to lose. It's about maybe some money, but it's money goes and comes. But when child is okay, is more happiness there.
It's more important than the money.
Yes, child is more important than the money.
Yeah.
So it's the last chance we have, I think, because it's the last technology you have for the autism. It maybe something comes later, but maybe not. So I will try it now.